All right, good morning, everyone. Morning. So, I believe in science, as does everyone in this room. Most of us have even built our careers around it. And yet, I think we can all agree that science has some limitations. It needs a sidekick, a Chewbacca, a Robin, a donkey. And that's where stories come into play. Stories have a power that science does not. Stories have the power to connect people, to change hearts and minds. According to the Yale Program on Climate Change Communication, 2/3 of Americans believe that global warming is affecting them personally. And yet, 2/3 of Americans also say that they rarely or never discuss climate change with friends and family. Stories and communicating about climate change makes it the social norm. Climate change feels over there. Stories make it so that it's happening right here. Climate change feels abstract. Stories make it real. And it is real, and that's what brings us all here today. My name is Neelu, Tummala, and I'm an ear, nose, and throat physician in New York, and on the executive committee of the Medical Society Consortium. I'm very proud to be here today as a part of this morning's session. Thank you to the consortium for inviting us. Ashley McClure, who's also co-leading this session, is unfortunately unwell this morning, but will hopefully be joining us in the afternoon. And I'm going to pass it over to Jo to introduce herself as well.
Let's see, I'm going to stick our slide up there if I can. Hi everyone, my name is Bjorgaard. I am a nurse and I'm the Senior Climate and Health Manager at the Climate Advocacy Lab. So first we want to acknowledge Marshall Ganz, as for the past 8 weeks we've been using Marshall Ganz's public narrative framework to coach these incredible storytellers to come and tell their stories today. Marshall Ganz is a legend and a community organizer and an all-around excellent individual, so just wanted to make sure we give credit there. Public narrative tells the story of why we care. It's anchored in our values, and narrative evokes the emotions to help inspire others to join us in our collective work. So these storytellers are going to focus on the story of self today, which is about the personal narrative. It conveys an individual's values and motivations, serving as the foundation of the public narrative framework. So by connecting personal experience to collective action, this inspires others to engage as well. We're going to hear about the different components of a story. These are called story moments. These are the key experiences or turning points in a person's life that shape their values, motivations, and commitment to action, making their narrative compelling and also relatable to others. So the story moments are the challenge. This is the challenge that you or your community has faced in the past or present. The choice is that choice, meeting the challenge with action. And the outcome is where this sort of motivation comes in. These give stories, these vivid images, and remind sort of community what you have achieved. Stories allow us to imagine a tomorrow dramatically different than from the world today and inspire the action necessary to move towards that different and better world, and something that we all need right now. So we're going to turn it over to the storytellers.
All right. So first up, sorry, just one second. We have Zayna. So Zayna is a healthcare sustainability consultant at Kimball Sustainable Healthcare and is co-founder of the National Health Administrative Climate Collaboration.
Okay.
Can you hear me?
Yes. Yeah. Okay. So I grew up in the Cascade Mountains outside of Portland, Oregon at the base of Mount Hood. My name is Zayna Salveter, and I have the unbiased opinion that I grew up in the best part of the world. So the Pacific Northwest is a place where the mountains seem to rise from the hills themselves, and the air smells like evergreen. But for most of my childhood, this beauty was blurry. I was about 8 years old when I truly saw the world around me for the first time, and it was the day I got my first pair of glasses. Suddenly, the trees weren't just shadowy figures. They had individual leaves, and the mountains weren't just distant giants, but they were alive. And that's when I made a decision. An 8-year-old's big, bold dream, I wanted to be an ophthalmologist. I wanted to give people the clarity of the world that I had just discovered. My second eye-opening experience happened in high school during a summer of clinical shadowing. While I observed what it was like to manage the daily patient load, I also noticed how decisions made behind the scenes didn't just impact the hospital. They affected the entire community in which that organization resides in. I was fascinated by this power of healthcare leadership, and as a high schooler, I thought, I want to make those decisions. And so I ran with that up to Seattle to pursue a master's in healthcare administration. And it was there during a climate change symposium hosted by a local health organization that I first listened to clinical experts speak about the devastating impacts of climate change on human health. And I was struck by one thing in particular. No one in my program was talking about this. Here we were being trained to be the next wave of healthcare leaders, yet climate change, the most pressing health issue of our time, was completely absent from our courses. I also realized that for me, it wouldn't be enough to just manage hospitals. If I was going to be the future of healthcare, I had to recognize this larger picture. And here's the reality. The very operations of healthcare are contributing to the climate crisis. And it's also one that health administrators like me have the power to change. And so back in our program, we started to brainstorm, how do we not only train healthcare leaders, but also stewards of the environment? This ended up us reaching out to MHA programs across the country to just ask, are you talking about climate change in healthcare? Almost universally, the answer was no, but what we got in return was students' strong desire to be a part of those solutions. And that's how we founded the National Health Administration Climate Collaboration, or what we called NAC. NAC is a coalition of MHA students across the country who are advocating, educating, and acting for sustainable health systems. We're all united under the mission that our health systems can coexist in synergy with our ecosystems. Amidst building NAC and, as almost if on cue, those beloved Cascade Mountains of mine caught on fire. And so as my family fled, those amber skies, I remember realizing that the community that NAC created and the conversations it started could not stop. And so 4 years later, planetary health and climate smart principles are becoming commonplace in MHA programs across the country. Obviously, for me, it set the precedence for my own career, where now I am a consultant at Kimball Sustainable Healthcare, where every day we integrate sustainability into the very DNA of healthcare operations. And to end my story with a nod to my 8-year-old self, us as healthcare have to put on our glasses and see with the utmost clarity that the health of our people are inextricably linked to the health of our planet. And I know that there's not a ton of health administrators in the room, but for the ones that are, we have to educate ourselves. So to health administrators, educate yourselves deeply on this topic. Talk to your champions, listen to your colleagues, and share best practices, because the next wave of healthcare leaders is going to demand that. So thank you so much.
That was amazing, Zayna. Thank you for sharing your story with us. So next we have Anusha, who's an infectious disease physician at UT Southwestern in Dallas, Texas, and she's the Vice President of Texas Physicians for Social Responsibility.
Thank you. All right, so my story starts on a Wednesday like any other in Houston, Texas, September 17th, 2019. I got to my clinic and there was a certain fervor in the air. There were nurses rooming patients at an alarming rate. Some of them were getting triaged right to the pharmacy to pick up their meds without even seeing us. I had so many patients in the waiting room waiting for their HIV medications and refills and prescriptions. I had no idea what was going on. It wasn't until 11 a.m. that our administration sent us an email saying, clinic is shutting down at noon for the incoming tropical storm Imelda. All of my colleagues who had lived in Houston for about 15, 20 years at that point were calling their families. They were like, we're hunkering down in this clinic. We are not stepping outside of this building, getting blankets from their cars. I chose a little bit differently. I was like, I've lived here for a year. I've driven through some rain. I'm sure it'll be fine. There is no way I'm not getting home to my 1-year-old and my husband. I also only live 2 miles from the clinic. So I got in my tiny little 15-year-old Honda Civic Coupe, started my trek, and about 5 minutes in, my car was 6 to 8 inches deep in water. My car didn't have 6 to 8 inches to go. So I remember calling my husband in a panic, crying. One of my biggest fears always has been dying in like a flood situation, unfortunately. And I was like, this is it. I'm going to have to walk home or swim home. There were so many questions in my head. I was like, can I even open my car door if it's flooded? Do I remember how to swim? And most importantly, what infections am I going to get as I'm trekking home in this? But the number one question on my mind that day was, how is my husband going to take care of our 1-year-old for the rest of our lives if I don't make it home today? And I remember him being like, you got to hang up the phone and stop crying and please focus on getting home. And I did. It took me about an hour, but I finally got home. My car made it through. He was able to get into his hospital where he was called in for work. And I remember at that time thinking how lucky I was that with this tropical storm, I had the social support, the financial resources, the emotional support, and luckily no like chronic medical conditions to kind of get through the storm, no pun intended. We, luckily had no damage, but I remember our clinic was closed for 2 days after that. We had numerous pharmacies that were closed for months to rebuild from this tropical storm. One of the hospitals in Houston actually had to shut down during the storm and transfer all their patients out because the kitchens in the basement were flooded. I remember seeing my patients at that time who were incredibly vulnerable, not being able to pick up refills for months, not being able to get back in the clinic for their acute need, not having the transportation or housing stability to get to the hospital or really take care of their health. And it was at that point that I was like, you know what, as a physician, as you kind of mentioned, I feel that I do make an impact on daily patient care for individuals. But I was like, something has to be done at a higher level because this is not an individual problem. So that's when I started sort of my personal deep dive into my research on the effects of climate and health. And when I ultimately left the crazy flooding, storming mess of Houston and moved to Dallas, where I'm from, in 2020, and I joined UT Southwestern, I started working on this elective for our med students because I think one of the most important things is that our future students and our healthcare professionals need to be trained on the impacts of climate and health. This is not a problem for the future. Like you mentioned, this is a problem it's for the past. It's already happening. And we are seeing these effects on our patients every single day. At that time, I also was lucky enough to get involved with Texas PSR, for which now I'm the vice president, and working more at a community and statewide level in really incorporating climate health education into not just our medical school, but hopefully all of the schools across Texas where we know it's a big growing need. In the last couple of years, we've flushed out our elective. I think it's becoming very popular. We've gotten our curriculum into the entire pre-clerkship curriculum for our med students. And the best part about that was the zero pushback I got from the med ed committee and really all the higher ups at our medical school who realized that this is not a question of if you believe it, but do you understand it? And so, with the work with Texas PSR at UT Southwestern, I was able to be graciously invited by our host at the consortium to share my story. And I thank you guys so much.
Thank you for that, Anusha. So again, as we're listening to these stories, we really want you to be listening for those three elements: the challenge that these individuals were faced with, the choice that they made, and the incredible outcomes that have taken them on their climate journeys. So next, we're going to hear from Burcin, who's a neuroscientist, researcher, and founder and chair of the International Neuro Climate Working Group.
Thank you so much, Neelu, and thank you so much for all of you being here. A few years ago, I was walking my son home from school when he asked me a simple question. Mommy, what is climate change? He was a kindergartner at the time, and he loved learning about science, nature, animals. And he often asked me scientific questions like these on our after-school strolls, where I loved putting my scientist hat and sharing interesting facts with him. That day, I took his question as such and started telling him about carbon emissions and global warming and what they mean to polar ice and wildlife. I was expecting his usual return of eager questions back, but instead I noticed that his face grew more and more alarmed with what he was hearing. He looked scared and worried. This stopped me and made me realize how grim my children's future looked due to the escalating climate crisis. I felt an equal worry and sadness inside me. And his question also reminded me of a frightening experience we had the summer before when we visited my family in Turkey, where I'm from. And we were home with my parents, and a wildfire broke out near my parents' home, and we had to evacuate for a little while. This was very scary to my children. And later, my parents told me how frequent these wildfires were becoming in that region, which was something we had never experienced when I was a child living there. Up until that point, I never thought of climate change being connected to these disasters happening in my hometown. As a neuroscientist studying brain disorders, and we scientists love our silos and our specific departments, I always thought of climate change as someone else's problem, a distant issue that maybe the climate scientists should tackle. But that day, I realized that, nope, this is not just somebody else's problem. It is all of our problem. It's mine to solve as well. So looking at the tear-filled eyes of my son, I realized I had a choice. I could either temporarily ease his fears, or I could empower both of us to become part of the solution. And I chose the latter. I told him there are hundreds, if not thousands of people, such as yourselves here, working against climate change, and we could join them too. This really energized my son. He literally skipped back home, and we sat on our dining table with pieces of paper and markers. And my son immediately started sketching an island, a special safe haven for his beloved animals. And each animal held a placard that said, "Keep the oceans clean, protect us, save the planet." And I looked down to my piece of paper. I'm not as creative as my son. I looked, and it was completely blank. And I'm like, how can I most meaningfully contribute to this global battle? I thought, well, I know a little bit about the brain, so let me first see what we know about climate change's impacts on the brain. But my initial search didn't give any results. So I started digging deeper and started finding researchers and scientists in different disciplines, in epidemiology, in psychology, in environmental science. I started finding clinicians, public health and policy experts, who are all in isolation trying to solve one piece of that puzzle. In my conversations with them, it became clear that for us to be able to solve this big puzzle around how climate change and brain health, we had to come together and collaborate. This led to the journey of building the International Neuroclimate Working Group, which is now a global network of more than 150 members from 35 different countries, dedicated to studying and understanding and addressing the impacts of climate change on our brains. The most recent wildfires that happened in Los Angeles, where we live now, caused yet another temporary evacuation for my family. And it reminded me again how wrong and naive I was to think climate change was somebody else's problem to solve. It is a global threat that is affecting each and every one of us. And no matter what our profession is, no matter where we come from, we have a role to play in it. And the time to act is now. Thank you.
Great, thank you so much, Burcin. I think your story is a really good example that stories have a power that science does not, and it's the power to change hearts and minds, so thank you. So finally, we're gonna hear from Trisha, who's an MD PhD student at Duke University, who has been leading curricular efforts to increase climate change education at Duke across various platforms.
On Saturday mornings, I remember spending hours with my parents at the local Indian grocery store. I loved watching my parents pick out all the produce for our next meals, and I loved being surrounded by the tropical fruits and vegetables and their smells. I learned to pick the softest okra and the spiciest peppers. I also remember my parents buying many, many bags of the soon-to-be discarded or damaged produce for $1 each. When we got home, my dad would meticulously wash and cut the spoiled bits. My dad's a pretty quiet guy, but as I helped him, he would start telling me stories about his childhood. My dad grew up in India and worked in the rice paddies with his own father. As the oldest sibling, he was in charge of harvesting the rice and storing all of the rice throughout the year. And then throughout the year, him and his siblings would go retrieve some of the rice to feed the family. Even the rice husks were used to build the roof of their house every 2 years with mud. And this was resistant to a lot of the floods that were happening from the monsoons. Unfortunately, his hometown was frequently plagued with droughts, and this would devastate the harvest. And so during the monsoon rains, his siblings and him would rejoice and dance in the rain, knowing that a good harvest was coming, and that meant another year of secure food and shelter. At the end of his story, my father and I would gather the scraps from our produce and put them in the compost bin, which fed our own supply of curry and papaya trees in Georgia. This ritual I shared with my parents really instilled in me the beautiful cycle of using damaged products to build something new and repurposing to minimize waste. And I carried these lessons into my adulthood. But during medical school, it became increasingly challenging to be green. Undercaffeinated, I started drinking coffee in single-use cups. And hungry, I started eating food in the cafeteria using the styrofoam trays. When I started asking for simple changes in the medical school, or what I thought were simple changes, I was met with resistance. For example, when I asked for a recycling bin to be brought into a lecture room that always seemed to have a trash can full of Diet Coke cans, I had to send a slew of emails and was ultimately told, no, I can't bring that recycling bin in. When I talked with my classmates, I learned that all of them were also concerned about climate change, but just couldn't prioritize those concerns right now. We often joked that we were drinking from a fire hydrant, getting drenched with medical minutia, and we were just trying to stay a little dry. I was having this internal battle, trying to balance those core virtues I had learned in my home kitchen with the reality of my profession, and this was deeply unsettling, as well as leading to my own burnout. I think I bothered enough people about the things that bothered me that in 2022, I received an email out of the blue to join a group of faculty members who were building a course. The call was to build an interdisciplinary course across the health system with faculty members as well as students to address climate change and health. I hesitated to join this team because it seemed like a lot of work. I also didn't want to work with a group of faculty members who I didn't know. And then finally, I questioned whether it was going to lead to any of the direct changes that I wanted to see at my institution. But ultimately, after thinking this over, I decided that it would be better to join this community than to be angry and live in my solitary inaction. So during this course, we ended up having many, many conversations, and I had a seat at the table. And I was excited to be able to voice all of the things I wanted to see even beyond the course. And I was excited that a lot of the faculty members wanted to join alongside me for the initiatives that I wanted to lead. It was also inspiring to hear about all of the changes that they were doing in their own time outside of their on-paper roles to green their respective departments. Together, we learned that learners are highly motivated to practice climate-friendly behaviors at home. However, almost all of them reported that they did not do so at work. It was simply too hard. Many of the learners also reported that they were very uncomfortable talking with workplace leaders and administrators about sustainability. The most important lesson we learned, though, was near the end of the course. One of the students participating came up to talk with me. She was a graduate student in the School of Environment and researched air pollution. From the get-go, I had assumed that she had a community of climate activists and sustainability go-getters around her. But as we talked, she told me that she actually felt quite alone, and she wished that she had this community of climate activists around her earlier on in her training. This was surprising to me because I really had thought that I was one of the few feeling so alone. A couple days later, the course evaluations came to my inbox. Almost every single student requested more in-person events for the upcoming year, and many of them thanked us for having a course that was interdisciplinary, bridging multiple professions across the health system together. Many of the students also directly thanked us for not making them feel so alone. Reading all of these comments transported me back to my own childhood kitchen. I remembered how easy it was to save all of those pounds of produce with my father and cook a beautiful meal with my mother. Sustainability is easier when it's in community. So my call to action is that we need to make space for conversations and stories. I want all of us to exchange numbers while we're here at this conference and to take your stories and share them with others so that we can build a network of stories that fuel us in this battle against climate change.
So a huge thank you to all of our storytellers today. Let's give them another round of applause. It's not easy to tell your story. It can be vulnerable and uncomfortable the first time or the 100th time. And these storytellers practiced with us and workshopped their stories and did an incredible job today. I hope you can all feel the power of storytelling. And it's through these stories that we web together our public narrative and build our narrative capacity to build strength and power in our movement. So if you enjoyed this and you want to work on your own stories, come to our workshop this afternoon where you'll be able to do so. The workshop title is Harnessing the Power of Narratives to Advance Public Understanding of Climate and Health. And that's just what we'll be doing. We'll be working with you to develop your own stories. So another massive round of applause. Thank you to all of you with so much admiration.